I'm Dr. Richard Matto, co-founder of the Matto Center for Dental Practice Success, and welcome once again to the next episode of the Dental Practice Fixers podcast. We've got some really great stuff for you today, and it's centering around missed opportunities. Missed opportunities. Geez, we have missed opportunities in the dental practice day in and day out. So I'm going to just talk about one really briefly, how to remedy that, and then we'll do a couple secret shopper calls that really will show you some missed opportunities. And I got to say, of all the secret shopper calls I've ever done, I don't know if the second one we're going to do today is the craziest, the worst, the best. It's the most recent, and I'll tell you something else. It's probably the longest. Oh man, you just got to hear what was going on in this dental practice. I totally didn't get it, but we'll find out soon when we talk about some missed opportunities. I'll tell you something. One missed opportunity is if you're overpaying for your credit card processing, because chances are when somebody pulls out their credit card at your office, you're paying a percentage to Visa, MasterCard, Discover, whatever, but you're also paying a percentage to your credit card processing company or your bank or whoever is handling your dental credit card processing, because just about every company charges a percentage. So I'm going to say it's a huge missed opportunity if you don't switch to Stacks by Fat Merchant. We've been using Stacks by Fat Merchant for several years at the Matto Center, and we save maybe hundreds or thousands of dollars every month. We save a ton of money because, along with hundreds of dental practices across the country that we've recommended Stacks to. Why do we save money, and why will you save money? Because instead of charging that overage percentage, they just charge a very low and very flat and very monthly fee. So instead of that overage percentage, just a flat monthly fee that's really low, you will save money. So check it out. Check out Stacks by Fat Merchant. Just go to matto.com/save, MADOW.com/save. You can talk to the fine folks at Stacks, and they will let you know if you'll save money or not. So if it won't work for you, then you don't need to switch. But if it will save money, and they will certainly know, then make the switch. And if you don't, that's the number one missed opportunity we're going to talk about today, overpaying on your credit card processing. So go to matto.com/save. Okay, here's another missed opportunity, a dental office missed opportunity that I just want to talk about really briefly. When you have a patient come in, but either a new patient for their exam or a hygiene patient for their recall, their recare, their maintenance, whatever the heck you want to call it. I don't care what you call it. That doesn't matter. That's just semantics. I hope you're doing a blood pressure reading and an oral cancer screening on them, because let's face it, you should. And we want to elevate our dental office to a high level of service, things that people don't get elsewhere. So let's just say from now on, we're going to be doing the blood pressure. Just use one of those little wrist cuffs. Yeah, I know they're not accurate, but whatever. Just use one of the little wrist cuffs. And let's do an oral cancer screening on every single patient who comes in for hygiene or for a new patient exam. But the missed opportunity is not only if you don't do that, but also if the patient has no idea what you're doing. And people have told me this before, and I've experienced this as a dental patient as well. You'll get in there and the hygienist will ask you to stick out your tongue, and she'll grab it with gauze and examine and stick the mirror in your mouth and look at your cheeks and your oral tissues, and then palpate the glands under your mandible, neck, whatever. Just do that whole rigmarole, oral cancer screening. But 99% of the time, they never tell the patient what they're doing. So this is not a missed opportunity clinically, but it's a missed opportunity customer service-wise. And I've had people actually ask me, friends of mine who have said, hey, I went to the dentist and the hygienist did this and she did that. What the heck was she doing? She was doing an oral cancer screening and she didn't tell you. So tell the patient when you're doing it. Very simple. I'm examining your tongue. I'm looking for lesions and anything that looks unusual, any kind of bumps or things that just don't look normal. And the great news is everything looks normal. And I'm looking at the inside of your cheeks. And now I'm feeling the glands around your mouth area to make sure there's no swelling. Wow, great news. I was just doing an oral cancer screening and everything looks fine. So let them know what you're doing. Same thing with a perio exam. Let them know that you're checking for inflammation and infection. Let them know that instead of them hearing 3, 2, 3, 3, 3, 3, 3, 2, 3, 3, 2, 3, 3, 2, 3, 3, 2, 3, 3, 2, 4, good one, 3. They don't know what the heck's going on. Let them know that you're checking their gums for inflammation and infection. And the gum disease is the #1 reason why adults lose their teeth. So this is very important. And now again, notice I'm talking in terms that a 6th grader could understand. We use this instrument, it's like a little ruler, and it measures how tightly your gums are attached to your teeth. And if you hear a 2 or a 3, that's really good. That typically means there's no inflammation or infection. If you hear a larger number like a 4 or a 5 or a 6, well, that's an area where we're really concerned. There could be some inflammation and infection in your gums. Again, simple terms, but let them know what you are doing. Don't miss this opportunity. Every single thing you do on a patient, don't assume they know what you're doing, because they don't. So tell them, and tell them why it's beneficial and why it's important, and do the whole thing in language that a 6th grader would understand. Boom, no longer a missed opportunity. Okay, that's our second missed opportunity of this podcast. Our third missed opportunity is if you're not selling your dental scrap and gold and palladium and all that stuff, you are throwing money away. And even if you're selling it to one of the big companies out there, or the person who comes knocking on your door cash in hand, you are missing out because they're not paying you nearly what they should. They are ripping you off. So don't miss this opportunity. Use my friends at Southern Dental Refining. They are the best. It's a small, family-owned, low-overhead operation. They absolutely pay more than anyone I've ever seen, and they will prove it to you. So give them the chance to. Go to maddow.com/gold, MADOW.com/gold. Check it out and see how much they'll save you. Okay, that's 3 missed opportunities, but here's maybe the biggest one, and it's going to revolve around our mystery shopper calls. In today's calls, I play the part of, I love this, I play the part of, I think I was using some kind of weird voice. I'm not sure. I'm worried that people will start recognizing my voice if they listen to the podcast. So this is a missed opportunity. A patient goes to a dentist. They're told they need about $8,000 worth of treatment. And then a few months pass, and for whatever reason, let's say non-disclosed, whatever reason, they want a second opinion. So they want to get a second opinion on do they need $8,000 worth of treatment. And also they want to find out if this office does any kind of payment plan, financial arrangements, whatever it is. Okay, simple questions. How should you answer? We'd be glad to have a look. Come on in. We can see you tomorrow at 3:30 p.m. If that's not good, we've got Friday at 11:30, which works best for you. Of course, we do financial arrangements. We can do 12 months interest-free. That's great. Just make it simple. Yes, if you're taking Care Credit in your office, if you're utilizing Care Credit, you do financial arrangements. You do 12 months interest-free. So yeah, the answer to that is yes, you do financial arrangements. Yes, you'd love to have the patient come in for a second opinion. This should be the simplest, fastest, no-brainer call of the century. So let's see how our 2 offices did it. Okay, I'm going over here to Command Central. We're lining up call number 1. Let's get a quick second opinion.
Thank you for calling. How can I help you?
Yeah, I saw a dentist a few months ago, and they told me I needed about $8,000 worth of dental work, but I wasn't so
Okay.
sure. Would you do like a second opinion?
Yes, we could do a second opinion. Let's see. Did they do X-rays at the other office?
They did some X-rays, yes.
Okay, because we would definitely need a copy of that.
Mm-hmm.
Otherwise, if we do them here, you would be charged for them because I'm pretty sure the insurance probably would not pay for them again.
Okay. And also, if I do need that kind of dollars worth of dental work, do you have a way that I could pay that over time?
No, unfortunately, we do not have that. But again, you'd probably speak to the office manager regarding that. Jamie is out to lunch at the moment, so I can't ask her.
Okay, so so I couldn't
know we
do
don't have a payment. We don't have a payment plan, but I think if you are able to speak with the office manager and make some arrangements, it's a possibility. But I don't know for sure.
Okay. So what do you do there?
I'm the front desk.
Okay, got it. All right. Well,
Yes,
thank you so much.
You're welcome.
Okay.
All right.
Bye.
Thanks. Bye-bye.
Oh boy. The office managers are out to lunch. I would say everybody's out to lunch. Now my empty cup is not as sweet as the punch because, wow. I mean, X-rays, X-rays, X-rays. Insurance won't cover this. Insurance won't cover that. We do not do payment plans. There's no way we do it. Now, if you talk to the office manager, maybe we'll do it, but we don't do it. So maybe you'll do it, but we don't do it. Holy moly, I'm totally confused. She never offered an appointment, didn't make me feel welcome, brought up the X-rays and the insurance and the fact that they won't do a payment plan. This is a patient that needs a ton of treatment that wants a second opinion. Why not get them in? Get them in, then you can talk about the X-rays. Then you can talk about the payment. And you know what? I have a sneaking suspicion this practice does accept care credit, because just about every office does. And this woman works at the front desk. Inexcusable. She should have got me in. At least got my contact information, but more so got me in. And I don't care if Jamie's out to lunch. That's no excuse to give bad information or misinformation. Total missed opportunity. Okay, can this happen again? Let's go over here to Command Central for call number 2. I want a second opinion on $8,000 worth of dental treatment. I know I need it. I want to get it somewhere. I'm calling your office. What are you going to do? Are you going to get me in or not? Let's find out.
To connect you with the right person, please select from the following options. To make an appointment or reschedule an existing appointment, please press 1. For billing questions, please press 2.
Since I went through that, they better be connecting me with a real expert. Pick it up.
Hello, hello, Lori speaking. How may I help you?
Hi, is this the dental office?
Yes, it is.
All right, okay. Question for you, Laurie. I went to a dentist a few months ago, and they said I needed a lot of dental work, like $8,000 worth. But I was really surprised, and I'm thinking about maybe getting another opinion. Do you do second opinions?
Absolutely. I would say that I'm assuming that the office that you went to probably took a full set of films on you.
Film? I don't know about any films.
Like a full set
they took some X-rays.
But did they take an X-ray like of your entire mouth? It's kind of like it would have been 18 films or a machine or one picture where the machine went around the outside of your head. Did they do that for you?
Oh wow, it was a few months ago. It seemed like they did a bunch of X-rays. Yeah. Yeah.
Well, I mean, we would definitely need film to be able to provide you with basically it's us doing a comprehensive exam on you, which would be looking at everything. And we need a full set of films to do that, to be able to tell you what we see, and then you could take it from there. Yes. Let me ask you, well, first of all, who am I speaking with, please, sir?
Oh, Johnny.
Is there any dental insurance involved, John?
I don't have insurance, which is why I'm also concerned about the next question, which would be if I really do need that much, do you offer like a way to pay that maybe over a little bit of time?
Well, there's a twofold thing here. We're involved with something called Care Credit, which is like a credit card for dentistry. Long and the short of it is anything over $1,000, it's 12 months with no interest, but that's not through us. So basically you'd be charging it with us and then paying them off. We do have an in-house dental plan. We're not set up to be able to do payments over the course of time. It's just not a realistic thing. But I will tell you this, just sort of in a general sense, obviously, because I don't really know what your needs are. If it's multiple crowns, are you missing teeth? Do you need a bridge? Do they talk to you about implants? There's a lot of variables. So I'm just going to talk to you generically. We do have an in-house plan. It's called Colonial. Basically, it's $299. Like if you were calling me not for a second opinion, but just to be a patient, it's $99 for 12 months. It will take care of your comprehensive exam, which is $85. It will take care of your full set of films, which is $155. It will take care of 2 cleanings in the course of 12 months, which are $115. And it gives you a 20% courtesy off of any treatment that we provide for you. So with that blanket thing being said, regardless of your dental needs, that's what we have for patients who don't have insurance, or if you have an insurance plan that doesn't cover some of the things that you might need to have done. So that's one piece of a financial discussion. Generally speaking, when you're having large work done, we'll just use crowns because they're easy, or even a bridge because they're easy. They're 2-part visits if it's a crown that you need, or a bridge. Basically, we prepare the tooth one day, we get you back about 4 weeks later. As long as it fits great and looks good, we cement it, it's delivered, and that piece of your overall treatment plan is done. Normally, it's a deposit when we start and balance when we're through. The only thing with using the Colonial plan, if Care Credit is something that's intriguing to you, it can't be utilized because we're already giving you a courtesy discount, as it were, because of your participation in the plan. So you can't use our in-house plan and Care Credit, because Care Credit, it's a little bit pricey on our end. We just can't do both. For work like that, everything, so it's a 2-visit appointment for those kinds of things. If somebody's telling you that you need $8,000 worth of treatment to overall to get your mouth as optimally healthy as possible, I can only make an assumption that it's probably over the course of time, and not sit down in the chair. We're going to work on you for 6 hours and you're going to leave and you're going to be completed. I don't know that. So there's a lot of variables regarding how, like normally what I'll tell someone, say you come to our office and we tell you for reasons A, B, and C, you need 1 root canal, you need 5 crowns and 1 bridge. I mean, that's a lot of work. Usually it's you do one thing at a time. We prioritize. Obviously, if there's a discomfort issue, that's the head of the class. So we prioritize and we piecemeal it. We do one section at a time as your situation allows, is basically what it really comes down to, because we can tell you need whatever you need, but people can only do what they can do.
Okay.
So if they, you know what I mean? So if they presented an overall treatment that ultimately is an $8,000 price tag, it could be over the course of a year. It could be over the course of 2 years. Because just because somebody tells you you need something doesn't mean you can do it, or at least not right now.
Right. So it's not necessarily like take it or leave it.
Absolutely not.
Right.
I mean, for sort of reasons, one of my favorite things to tell patients, whether it's because it's a huge treatment plan or because you're really afraid, or a combination of the two, as long as you never leave our office without something scheduled in the future and you plug along, eventually everything gets done. The only things that become an emergent issue is if you need a root canal, you really do that sooner rather than later so you don't run into a problem. So there's certain things that might be a little bit more, Johnny, you really need to do this sooner rather than later kind of thing. But for the most part, whatever they see on the films, whatever they're going to suggest to you that they see as what you need to get everything healthy, it's definitely over the course of time. Because how can it not be? How can it not be?
Right.
If a person can't, if you can't, I couldn't pay $8,000 if I was told I had an $8,000 treatment plan. I'd have to figure it out, and I'd have to go, well, what's the most pressing thing? Let's start there.
Right.
Let me do it. Let me regroup, and then we'll move on. So, that's the same for anybody.
Right. Okay, I think I understand. I really appreciate you taking all this time to explain it to me. Thank you so much.
No problem. If you need us, give us a call.
I appreciate it. Thank you. Bye.
Bye-bye.
OMG. Holy moly. That was unbelievable. She gave so much useless, unsolicited information that may or may not apply to anything. 8 minutes and 38 seconds. 8 minutes and 38 seconds. And then still didn't ask for the appointment. Didn't even make an attempt to ask for the appointment. That was unbelievable. She actually started really well. I asked if they did second opinions. She said, absolutely. But why not say, come right in? Come right in. I mean, after a while, you remember that old Cheech and Chong routine, Sister Mary Elephant? I just felt like saying, class, shut up! Oh my God, that was just unbelievable. She started saying, do you have films? I mean, that's dental lingo. Nobody knows what that means. Either have 18 films or a machine goes around your head. She's like grilling me, brings up insurance. I said, do you take payment plans? She said, no, we don't. But then she said, well, we're involved with this thing called Care Credit, but you can't use that if you use Colonial. Let me tell you what that is. Let me tell you. Then she starts going to all this treatment, bridges, root canals, crowns. It takes 2 appointments. It's 4 weeks apart. What? It was unbelievable. I mean, come on, you're killing me. I just wanted a second opinion. Within 30 seconds, she should have had me off the phone and into that appointment book. Everything else can be talked about later. And then when I said, do you take payment plans? Yes, we do. We do 12 months interest-free. Boom. I mean, that was just unbelievable. Talk about a missed opportunity. She wasted 9 minutes of my time, which wouldn't have been a total waste if she would have at least asked for the appointment. That was just unbearable. Missed opportunity and wasted time. Oh, my. I think on that note, we better wrap it up. But hey, if you have a question for us at the Dental Practice Fixers podcast, a question you want me to discuss on the podcast, a secret shopper call you want us to do, whatever it is, easy to reach. info at Maddow, MADOW.com, or you can reach me. Everything gets to me eventually, but you can also hit me up personally. My personal email is rich, RICH, at Maddow.com. I think we better wrap that for now. I'm Dr. Richard Maddow, co-founder of the Maddow Center for Dental Practice Success. Thanks for being with us today on the Dental Practice Fixers podcast. Hope to see you soon. Bye.